Yeah. They're only going to see you on that until he's done lecturing, and then I'm putting this.
Somehow in there, I forgot to turn my presentation back on. Oh, well. Okay, so I hope you can see my screen. Is that correct, Pamela?
Yes, it is.
Okay, good. I'm a dermatopathologist, and I have two of my staff members, Kim Radigan and Devin Boyle, with me. So I'm going to go through a brief lecture. It's actually about 25 minutes or so, and discuss and demonstrate biopsies. And then we're going to have a live demo in which you'll be encouraged to bring out your tools and from your toolkit. The only thing I see that we forgot from the toolkit is our gloves. Now, the pig skin that's provided is food grade, so there should be nothing harmful in there. But for those of you who have issues, you can wait and do this another day when you do have gloves. The second warning is that there are sharps there, so be careful. Dispose of your sharps. One handy way of disposing of sharps is to put them into a soft drink bottle or a Poland Spring water bottle and cap it, and then you can leave it in a sharps container at the school. But I hear that's going to be shut down for a while. If you just cap it in there, you can put it in the trash, and no one will be harmed. I am an adjunct professor at Stony Brook University in dermatology and emergency medicine. If you wish to contact me, you can write this down, info@McClain Lab, or you can text photos to my cell phone number. The purpose is to discuss,
Your slides aren't up.
My slides aren't up. Oh, well, let's see. It says I'm sharing. Pause share, unpause share. Whoops.
Dr. McClain, your file program or your file folder.
Oh, that's what's showing up. Okay, so let's stop this share and share a different screen. How about this one? Okay, there we go. Okay. So this is, the title is You Need to Do a Biopsy. And so the first decision you have to make is that a biopsy is needed. And the reason for practicing now is you don't want to come up to a patient and never having practiced before. For those of you who have animal issues, you can try potatoes. You can try biopsying the peel of an orange or even an apple. So those are acceptable alternatives. It's really about developing the muscle memory. Let's see, that's not working. Let's try this. Okay, so we're going to discuss the deciding to biopsy, the consent and complications of biopsy, the instruments, compare and contrast good biopsy technique, and a reminder that formalin is the universal fixative except for some certain circumstances, namely gout, when you need to do a culture are the two primary reasons, or you need to do PCR. In those instances, formalin just wrecks the test. Now we have a method for recovering gout from formalin, so it can be done even if you mess up. Oh, this is not working so well. Okay. All of you are way younger than I am, but you know that there's ways of capturing screenshots. So on a MacBook, it's Command, Shift, and 3. It'll save it to your desktop. Or the Windows computers, you hold down the Windows key and hit print screen, and it'll dim like that. So those are the two methods that you can do. Same thing with an iPhone or an iPad or an Android. So if you wanted to capture my email and my cell phone, now would be a good time to do that. I am an academic dermatopathologist. I just published my 100th paper several months ago, and I haven't really looked back to count, but it's coming up to the end of the year, so I'll do that. I've been in academic life for almost 28 years now, since 1992. the take-home message is the reason we biopsy is to save a life. If you see something and need to biopsy it, you need to get a pathologist report, and that's why you biopsy. Um, one of the tools that the dermatologist uses is a dermatoscope, and I hope early on in your career you'll make a decision to purchase it. But you make an early diagnosis, you biopsy early. When in doubt, biopsy. You send the specimen to a quality lab, and then you make certain that if it's a cancer, that it's completely removed. Oops. So always biopsy if the patient really wants a biopsy and you're capable of doing it, you should do it. The reason for that is that in general, the patients are going to go to somebody else. And they commonly say, you know, that other podiatrist didn't biopsy this. Or if they want the biopsy, they're going to go get it. They're going to go to the person they consider a better podiatrist, the one who will give them a biopsy. If the patient's already been to another podiatrist for the same problem and it's failed, that's a good reason to biopsy. My favorite rule is always biopsy ugly or something you think might be cancer. When you need to apply some scientific new medicine, high-end drug, whatever, or a costly one, it's good to have a starting point. And this is also my rule. When the resident wants to know, I call it the 007 rule. If the resident or the student wants to know, then this is the time to learn. Well, when in doubt, as a resident, biopsy it. You see something you say, that should have a name, you biopsy it. This young man is a sad case, 18 years old, was treated by podiatrist 1, and then he retired, and podiatrist 2 took over. So for a total of 18 months, this lesion was treated with keratolytics. This pigmented lesion off to the side is melanoma, and this young man died from metastatic melanoma at the age of 20. If he'd only had a dermatoscope put on it, you'd see the pigment is on the ridges. The ridges are risky. If we look at there's a furrow right here. The furrows are not pigmented so much, but you look at the edge of the lesion. So when in doubt, biopsy. I'm going to skip over this one, but I've been working in dermoscopy for quite a while, and we actually installed them in the lab. This is the original one we used in the lab, and we've been doing this since 2008. But the dermatoscope works by allowing you to see down into the tissue, so you get a clearer view of what a potential skin cancer is. This is our newer model dermatoscope, and this is the image of a nevus on the sole. And nevi tend to be small, well circumscribed, and the pigment is in the furrows. So the lesson here is that the furrows are fine and the ridges are risky. And you say, well, this looks pretty irregular. Well, we're looking down into the tissue, and you see the pigment is at the edges anyway, is sparing the furrows, sparing the ridges, and it's in the furrows. So the furrows are fine and the ridges are risky. We call this a beauty mark. Here's one where the pigment is on the ridges. The ridges are risky. This is an ugly mark. This is melanoma in situ. So ugly. Beauty or ugly? You see something, you have to decide, is this a beauty mark, like Marilyn Monroe's lip, or is this an ugly mark? And so you have to make a choice. You have to make a decision. There's no in-betweens. If you say, I don't know, that's the same thing as saying ugly. And so you biopsy it. So these are examples. The way I teach the residents is always, always, always biopsy ugly. Now, we don't tell the patient it's ugly. That would be unseemly. But I teach the residents to use the phrase, You can practice that at home. Look at your kids or your wife. And they'll look at you with suspicious glances and wonder what's going on. But the patients will too. And they'll say, "What's up, doc?" And you, at that point, you tell them, you set the hook, you say, you might have to repeat it even sometimes, pause, you need a biopsy. And then you sign them up, you get their consent. The biopsy is a miniature operation. There's a consent, there's some kind of anesthesia, antisepsis like chlorhexidine or alcohol in the simplest forms, or a povidone, good surgical anesthetic. And you choose the method according to what you're trying to reach. If it's superficial, you can do a shave. If you want to remove it completely, you would excise it with a scalpel. If it's too large, you may incise it at the edge and take a portion of it, or you may curette it away as you might do for a wart. And then how do you stop the bleeding? You should be prepared and have a suture available. Not that you're going to need it with a 2 millimeter or a 3 millimeter, almost never, but having Moncels or 20% aluminum chloride is handy to have. And then you're going to have to bandage it somehow. If they have no platelets or they're on Coumadin or Xarelto, you may have to wait quite a while, but just direct pressure and waiting, you can wait it out and eventually the bleeding will stop. But if they have no platelets, it may take a while. It's taken me up to 45 minutes sometimes, but that was eons ago. If anyone needs a consent, I'm sure your institution has one, but once you go out into practice, you can download this off the internet. But here, this talks you through the biopsy. This is a good one. You might want to save this one. A skin biopsy involves removal of a small piece of skin under local anesthesia. It's then processed and examined under a microscope or is tested to obtain diagnostic information. You have to go over this. The reason you have them sign it is because patients never remember hearing the words bleeding, scarring, infection, nerve damage, recurrence, or need for further procedures. Patients oftentimes think you're going to remove the entire lesion when you're only going to take a piece of it. I understand a biopsy does not guarantee complete removal of lesion or diagnosis will be attained. In a small percentage of cases, other biopsies, other stains may need to be done. And then you explain to who's going to pay for it, their insurance or they are. And then, where do you send the results? Very important. Now, if they refuse a biopsy, you make them sign it to say refused biopsy and have them sign it. That protects you, the doctor. Okay, now a little demo on different biopsies. All the knives we're going to show you cut by slicing. You move the blade, the sharp edge over the object. So much the same way that you would slice vegetables or slice anything, they cut by slicing. Careful surgeons always label specimens. These 3 pieces of information need to be on every sample. Formalin is the universal fixative. Other fixatives, you can use 70 to 100% alcohol for gout. Michelle's fixative is used for DIF studies, direct immunofluorescence, for bullous pemphigoid or lupus. Fortunately, these are not very common in the foot. A dry container works for fungal nails, for PCR, or for gout, or for ganglion, any one of those. Careful surgeons always control their sharps and dispose of properly. So if you don't have a sharps bottle to put these into, then don't do it tonight, because you need to protect those and put them away, especially if you have other family members around. But if you're in the clinic the same way, you're the captain of the ship, you need to control your sharps. You don't want anybody injured, and you don't want to lose a specimen because you didn't label it. Okay, choosing an instrument. You can almost always find a scalpel. So you can do many of these biopsies by scalpel. And so this is a go-to technique. Use an instrument you're competent using. If you're not competent doing the punch biopsy, then don't pull out that tool. Use a scalpel. Punch biopsies come in many sizes, up to 25 millimeters. You can excise an entire lesion with a punch biopsy. Punches are 3 types. There's the ones you can resharpen, and you can go all the way down and get bone if you wanted to with this sharp tool. It comes out the top here. So this is a non-disposable one. There's disposable ones with a plunger, and these are the ones we're going to demonstrate for you today. And then there's the larger ones. They're disposable, but there's no plunger. These disposable ones with a plunger are more expensive. That's about a $4 tool that's in your kit tonight. Without the plunger, they're plugged. You can't blow the sample out. If the sample gets stuck inside there, use your anesthetic needle. I'm going to demonstrate that for you tonight. If you ask a pathologist which do they prefer, a 2 millimeter or a 3 millimeter, I can tell you almost uniformly will say 3. And there's a reason for that. Pi r squared, the 2 millimeter gives you about 3 millimeters squared of tissue, whereas a 3 millimeter gives you almost 7 millimeters squared of tissue. Twice the tissue in a 3 millimeter. Okay, a lot more room for error. There's always some crush artifact. So when you open your punches, I think they're in the safety position, which is this button is down, this button is down. And if you look at the other end, you'll see this is the safety position. And they have different sizes. This is a 2, this is a 3, and they're color coded. I like this company, but they come in all different flavors from all different companies. But this is a good one. It's by Miltex. Here the safety is off. You just push this button on the side to activate, okay? Much like an ink pen. Okay, we're going to demonstrate punch biopsies, a short little video. When you do your pig, it's helpful to make a mark with a Sharpie or an ink pen of some kind. And we do this in the patients. You'll mark it, and then you do your scrub and so forth, and then you'll raise a wheel, right, to inject it with local anesthetic, and then you'll inject down below. And so you want to get down into the dermal nerves here. But you'll mark with a Sharpie some aiming points. It's very important to have an aiming point, because once you inject the anesthetic, you lose your landmarks. Okay, so here's how a punch biopsy is done. We come in and you'll open your kit. Safety is on. Safety is on. You see the little pointer. You push the button. Now you'll have you'll come straight down, vertical, and these knives cut by slicing. So you slice, 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 just a quarter turn. Then when you don't want to go all the way to the hub. You need to leave 2 millimeters at the base here, and then you stop. You tilt 37.5 degrees exactly. Now that last little bit, when he tilted it both ways, he cut the pig skin off at the bottom. Now you pull it out, and you should have your little punch of tissue in there, and you squeeze it right into the formalin bottle. No crush artifact, no problem. Here's a larger punch. And this model actually has a hole all the way through. I don't know if you can see that. I didn't know that. This is an 8 millimeter punch. It's going to go all the way down. Now you can try and tilt it, but an 8 is really hard to cut off the base. Same slicing, tilt, but turn 1/4 turn back and forth until you get it all the way. Now in this one, you don't want to squeeze it with your forceps. This has been cut off, but you can use your anesthetic needle to gently pick it up. And with a pair of scissors, you'll cut the bottom off. You could use a scalpel the same way. Whoops, what happened here? Okay, I guess he's done. Whoops, we don't need to do that again. Okay, stop. There's bad biopsy techniques. The foremost of one is to use the wrong technique. Here, the pigmented lesion was sampled by a curette. We can see the pigment, but we can't tell much about what it was because there were only 0.5 millimeter fragments. This is what happens when you try and the punch didn't come out, so they attempted to put the punch back into the skin. Usually bad technique. Okay, don't try and cut it off again. If you fail, you can just you can go to a slightly different site, or you use your anesthetic needle. This is what happens when you squeeze it. You ruin the tissue. Almost worthless to the pathologist. All this is crush artifact, and we can't tell much about it. Crush artifact. This is almost always uniformly done by, almost never done by dermatologists, done by podiatrists, by and large. If you're doing immuno studies, the immuno in this half was damaged by the crush artifact, and so this is the same lesion all the way across here, except we can only see a few melanocytes. Okay, different bad biopsy techniques. The shave biopsy is literally called a shave because you raise a wheel and you shave it off. And so these blue blades used to be blue blades, now they're stainless. And it's an adjustable radius cutting tool, and you can adjust your radius. Now, we're going to do it in a little easier way. We're going to use this blade. This is the upside down. If you see it this way, this is upside down. If you're right-handed, you use it from this side. Look for the label, and then here's the sharp edge. Be careful of the sharps. You must control your sharps. If you're left-handed, you put it the other way, and this is operated between your thumb and third finger. You will use your index finger to bend the blade down and do it. So here's a shave biopsy. And again, you come in at a high angle, 37.5 degrees. Now this young man is left-handed. He's bending the blade with his index finger. And now he's going to come in at a high angle. He's tilting it, cutting 37.5 degrees. And now he's slicing back and forth. He's literally rocking his fingers. And once you're in, you can flatten out the blade. See him flatten it. And now he's going to tilt it back to get out of the pig skin. Okay. Okay. And now he's going to pick it up with forceps, but you just do it by the edge. You don't want to squeeze it. Okay. You do not want to squeeze these biopsies. You'll ruin it. Okay. Okay. Drop it straight into the formalin and then label it. You can do the same thing. Raise a wheel. Come in at a high angle with your scalpel, 37.5 degrees. Then you'll flatten your blade out parallel with the skin. And then you'll tilt it so it comes up out of the skin. You get to the other side. If you need a pair of forceps, some people will use an iris scissors to finish off their biopsy. Okay. Let's see. The curette. This is my favorite tool. Pathologists are idiot surgeons. At least I am. This tool has two edges. There's a sharp edge and a dull edge. And the way you can tell the difference is that the dull edge has a crosshatch. You'll feel it. You can tell. So you either use it with your thumb or your forefinger, and you hold it like a pencil. These are useful for treating things like molluscum contagiosum. Here's the umbilication, or warts, or wound healing. All good useful ways. And these are the kinds of samples that you'll get. You can get a very thin. You can take and you can shave across the entire pig skin. You're not limited to these little fragments. This was done by a timid podiatrist. Okay, we did. And this turned out to be, for a pigmented lesion, 32-year-old man, this was a bad choice of tools. Okay. So debridement with the curette, this is our last video. And then we're going to go to the live demonstration. Now notice when he opens this, you'll see the cross hatching. I think he should be showing it. There it is. This is the cross hatching. That's the dull side. So you can control the dull side, you can feel it. He's using his thumb to control it. And these also cut by slicing, but you're really going to scrape away the lesion. In the case of a wound, you scrape away all the dead tissue. You cut it away until you feel the hard dermis, the scrapey, scratchy kind of dermis. And then this gets dropped down into the formalin. Okay, I think that's about it. So tonight, as you do these, do your punches. This was done by one of my favorite residents. She spelled, fortunately, she has a 4-letter name. She spelled out her name on the foam pad there. Now I'm going to switch over to Kim. I'm going to stop doing this, and we're going to do a live demo. And you're welcome to join us at this point. I don't know what I need to do to switch over, but I can see Kim back in the back. Devin, do you want to turn on your?
Why can't I flip it?
Kim, which video do you want spotlit? Devin or Kim?
Kim.
Yeah.
Kim.
Which one?
Kim. Radigan.
Kim. Yeah, Kim Radigan, not Devin. Yeah.
Okay.
Let's make sure we're good.
Pam, can you hear them?
I can.
You can hear us?
I can.
All right, so she's got to switch over to Kim Radigan because right now she's on Devin.
No, we're on Kim.
We're on
you
Kim.
are. Okay, so this works?
Yep.
Okay, wonderful. Okay, hello everyone. My name is Kim, and this begins the live portion of the workshop. So if you could get out your handy dandy kit, and as Dr. McClain mentioned, I neglected to put gloves in the kit. So if you have gloves at home, great. If you don't, it's fine because this is nothing infectious in this kit. So let's set up your workshop table. So first thing I'm going to do is take out the chuck. I'm going to open up my blue chuck. Okay. Next, I'm going to take out the blue foam pad. Now, at this point, I hope you have opened up your pig skin, and you should have taken it out of the plastic and washed it in the sink and to remove all the salt. So I have a nice clean surface. It's dry and ready for action. So I'll give you a moment to get out your stuff. There's the pig skin, clean, dry, ready to go, on top of the blue foam, on top of the chuck. Okay, and then I'm going to take out my tools out of the bag. And I have 4 tools. I have the punch biopsy with the plunger. This is a 3 millimeter. I have my shave tools. I have a regular number 15 scalpel. I have a dermablade for the shave biopsy. And then I have, last but not least, our favorite tool, the curette. This is a 5 millimeter curette. And these also come in different sizes. So if you have these at the clinic, they have them in all different sizes. Same with all of these tools. Okay, so let's begin. What I'm going to do also, I'll give you a moment to, if you have a Sharpie, I like to maybe draw some figures on my pig skin. And there's a couple of pieces of pig skin in your packet, so you could use one now, save one for later, and practice at your leisure. You can also, if you don't want to use the pig skin, you can use an orange, you can use a potato, anything, other than a human being you're welcome to use. So let's begin with the punch biopsy. So I'm going to open the punch biopsy. Okay, and remember, this is the plunger. When I push the plunger down, it's safe. When I release the plunger, it's sharp. So be very careful with your sharps. So let's do a live punch biopsy. So as Dr. McClain stated, I'm going to rotate about 3/4 of the way down. I'm going to tilt 45 degrees. And then I'm going to withdraw this out. And here is my punch. Hi, Dr. McClain.
37.5 degrees.
Oh, okay. The teacher is here. I have to redo my experiment. 37.5 degrees. So let's do it again. I rotate, rotate, rotate. And this is thick skin. So don't be, shy because this is thick, old skin.
You're almost 70 degrees.
Okay, a little higher, Dr. McClain.
Yeah.
Okay, do you want to guide me?
And come back and cut
Okay.
it off. Okay.
Yep. And I recommend twisting to cut it. And then I'm going to pull it out gently.
Pull it straight up.
Yep. Well, I find if I pull it out sideways, they come out nicer. Sometimes they get stuck.
I know, but you're doing a lot of damage to the skin. And the
Okay.
human. That
Okay.
pig's not going to bleed.
Okay. So let's do another one. Want me to do one on one of the lesions? My fake lesions I can do. So I'm going to go here, twist, go across, twist. Here we go. There we are. You want me to do a few more, Dr. McClain, on one of the...
No, we'll give them time. If they want some time to do it, we'll give them a minute.
Okay.
You can do a few more if you want.
Yep, I can certainly write my name, Kim, small name. I find that the biggest help is the twists. The twisting helps cut it up. Now that guy got stuck. So I would take a forceps or my blade and try and lift it out, but he's stuck in the skin right now. And remember also this punch is going to start getting dull from the skin. So the more you do, the duller this blade gets. Let's go here. Oh, he's stuck too. This is good.
Okay, you're going down. Go ahead.
Yeah.
The key here is to leave some room before you hit the skin with the hub.
Right. So you want to zero in on that, Devin, so they can see I got a little space between the hub and the green part. All right, I'm going to pull this out. And he got stuck also. I think my punch is a little dull now. Okay. Try a couple more. And if anybody wants to contact us, Pam has my information. If you want a couple more tools to work on at home, you know, we're very flexible and we can certainly send you some tools at home to play with. Okay. Go on this way. Here we go. This is a good one. Plop. Should I do one more, Dr. McClain?
No, let's go on and
Okay.
work on another tool.
Okay, we're gonna go on to the shave biopsies. Okay, so this is your dermablade tool. We're gonna go on to the shave biopsies. I'm gonna open up the dermablade. Now this is a very sharp, bouncy tool. You can see it's very bendable. So be very careful because I've seen these pop out of people's fingers. I've seen them pop backwards. So be very, very careful.
Okay, you hold it between the thumb and the third finger.
Thumb and the third finger.
And you use the index finger to help you bend. You squeeze with your thumb and third and push it down, and that adjusts your radius. Okay, you start at a high angle, 37, and not super high, Kim.
Well, good.
Yeah.
Okay. I'm going to work on one of my little lesions here.
So you're in reality, you want to rock back and forth. So your thumb down and then your finger down and you alternate. Okay, you're going at a super high angle, Kim.
Okay.
Look at the size of that radius.
Oh boy.
There. Now, if you bend this too far, you will break the blade.
That is true. That is true. And it'll bounce out.
Now, you can do a shave excision. You can excise an entire lesion with a shave biopsy tool. And in fact, Mohs surgery is a set of repeated shave biopsies. So if there's still cancer at the base, you can do another shave that goes deeper.
All right, this is a pretty thick shave excision.
Right.
Look at the thickness.
Now, the
of
reason
this.
you got it so thick is you squeezed your blade together too tightly.
Okay.
What you want to do is just squeeze it a little bit, come in at a high angle and rock back and forth.
Okay.
Then once you're in, you flatten out your blade.
Oh, I see. Yep. Scoop it up.
These,
The deeper you make that, the bigger the scar.
Okay.
Okay.
Do you want to demonstrate?
So you'll come in at a high angle, start outside the lesion. Okay, you'll rock back and forth. Okay. Then once you're in, you could actually flatten the blade out.
Oh, that's beautiful.
Okay. And you can come around and cut it off from this side. Now, the reason dermatologists use shave biopsies has to do with the speed. They could do, dermatologists do 19 times the number of punch biopsies. They do 19 shaves for every one punch. Part of the reason is they heal really well. There's no sutures. And many times they heal even without a scar. You know, there's very little scar. Okay.
Okay. And I just want to make sure that nobody has any questions, because sometimes people ask, Dr. McClain, should I use the punch biopsy or should I use the shave biopsy? So what would your answer be, Dr. McClain, for a lesion? Which one should I choose?
Well, on the sole, the epidermis is maybe up to 3 millimeters thick. So you may have to aim quite deep in order to get into the dermis. So a punch biopsy or a scalpel may be a better tool. If it's on the top of the toe, for example, where you don't want to go deep or over a joint, a shave biopsy may be a better approach.
Okay.
Okay. You have to think about damaging nerves underneath. What's underneath that tissue, right?
Okay.
Anyway, let's
Want me
use
to go on to
another
the
tool.
scalpel?
You can do the same shave biopsy with a scalpel. Now, one thing you can practice with this pig skin, we didn't include any sutures, but you can practice making an excision and then practice your suturing on the pig skin. The pig skin is a very useful material to work with, and you can practice your surgical skills. So this is a number 11?
15.
15 blade. Okay.
Okay, and these are also very inexpensive. So I'm sure you'll see a lot of these at the clinic, the scalpels, compared to the dermablade that we just showed you, which is a much more pricier tool.
Well, it's not, this is about $1.50 actually, isn't it?
Yeah, this is like, you get 10 for, maybe $50 or less.
Right,
They're
they're
very,
about-
yeah.
Yeah, they're somewhere between $3.50 and $5
Yeah.
for the punch, the scalpel, or the curette.
Okay, so with the scalpel, I recommend cutting away from you, Dr. McClain. Is that a correct technique? So instead of me cutting towards myself, I was taught to go this way.
In the humans, what you would do is you'll do one of two things. You'll either stretch the skin or you'll squeeze the skin together. Okay. And at some points, you may be cutting towards yourself. Okay. So you have to do it in a very controlled way. You start out. Let me just turn it this way.
Mm-hmm.
At some point, you can raise this up. You'll come in at a high angle. You just want to get the blade into the skin, and then you can flatten it out. Okay. Look at this. We're barely shaving it off. Now, if you did that, that would heal in a matter of 3 or 7 days, and you wouldn't even notice it. So that would be a partial shave. What is better for the pathologist is if you get the whole lesion. Okay. This number 15 blade is really small. I think we should use a larger blade next time.
Okay, great suggestion.
Okay. Okay, whoops. There it is.
So you can actually see the blue through this. I don't know if you can see it there.
Mm-hmm.
Okay. So your goal is to minimize the number of the amount of dermal scar, because the more dermal damage, the thicker the scar, the more noticeable the scar. On the face, they literally, for a solar keratosis or something, they literally just shave the epidermis off.
Mhm.
Okay.
And Dr. McClain, sometimes people do 2 shaves. They do a very thin one, and then they do it again. So you could do multiple shaves on the same spot.
Yeah.
Okay. Bringing up some different ideas. Okay.
I call that a shave and a reshave,
Okay.
but that's not medically correct.
Okay, but if they feel they didn't go deep enough the first time, they could do a second one.
Mm-hmm.
Okay. All right. So let me do one more like this, the way he did it. Let me make another spot here, more in the middle.
This Sharpie doesn't work well on the salt on the skin, so it helps if you wash the skin and dry it beforehand.
Yeah, and oops, I got a little shave, so I got some of my lesion out.
You're pushing instead of slicing.
Yeah, you're right. All right, so this was a botch right there. That's not a good example.
This is why we practice.
This is why we practice, because this pig is not going to be upset tonight by my work. All right, so do you want me to move on to the curette, my favorite tool of all?
Now, in this particular manufacturer, when you open it up, the crosshatched side or dull side will be up towards you.
Yeah, let's see the crosshatch.
All right, so the sharp side is down in the package. Okay.
Now, if you recall, he said keep the crosshatch on top because the bottom is sharp. So wherever the crosshatch is, I'm going to put my finger and I'm going to do a nice little shave. Oh, look at that. That is like a paint roller on a wall. Look at that. That's beautiful. You get these nice thin little slivers. That is like a wisp of a shave. If I had to choose, I think I'd pick this tool. I feel like I have better control over it.
I keep these in my doctor's bag along with several punches as well.
Let me turn around like this. Put this sharp over here. You can also, as a point, you can buy this pig skin at the supermarket. So if you really want to go crazy and practice during this time that we're home on Zoom, you can certainly get yourself more of this. It's called Fatback, and Boar's Head sells it, or Smithfield's, and people cook with it. They put it in different kinds of stews. So that is our final tool, the curette. Okay, is there anything else you want to demonstrate, Dr. McClain?
Well, you haven't labeled your sample yet.
Okay,
and you haven't put your sharps away.
I haven't put my sharps away. So very important. So all of these sharps, I should have a red sharps container, need to go in a proper disposal. So I'm going to put them here for now. I'm going to.
Now, one thing you can do is to push the safety in on the punches.
Yeah.
There's 2 tools that won't cut you. So now
I put the cover back on this. And this, I actually would probably put this in here because God forbid a sibling or somebody at your house mucks around with your stuff. And I would put this all back in the bag like this. Okay.
the only thing you're missing is you're missing 1 sharp.
I'm missing 1 sharp. Oh, my
Curette.
curette. Thank you. Thank you, Dr. McClain. I could actually put this back in here too, just to be safe, since I don't have a sharps container here and they probably don't have one at home, but I put them all back in here just to be safe. and away from anybody else in your family. So do we want to open up to see if anybody has any questions about biopsy techniques? Pam, can you hear me?
I can hear you. If I can, I can stop the spotlight video.
Dr. McClain, I'll stop the spotlight video, and do you want to say a few closing words or see if anybody has any questions?
Sure. Someone asked me a question by chat about why the 37.5-degree angle. And my reply was that any relatively high angle will work between about 33 and 45. But the important part is to be precise, that you do it exactly the same way each time, that you're aiming the same way. So when I say 37.5, then you know what you know what you're aiming for. Now I'm gonna share my screen. Can you see that? I hope. Let's see if I can get this down here. Let's go back to the very end. Okay, here we go. We biopsy to treat. We biopsy to confirm your clinical diagnosis. When I say biopsy, it really means just submitting a sample to the lab, obtaining a human sample to send to the lab, whether it's the epidermis, the dermis, whether you're aspirating a digital mucus cyst. You're submitting a sample to the lab, whether you biopsy to submit for culture. When you do a debridement, your debridement can go to the lab. So it doesn't necessarily mean using a biopsy tool. You could be doing a scalpel, or using a syringe, and so forth. You could be using a Jamshidi needle. You could be using bone nippers. Any of those samples can go into formalin and be sent to the lab. You biopsy when your treatment fails. And biopsy with pathology means you have the power to treat. If you say biopsy proven, insert any diagnosis that's your favorite. Biopsy proven malignant melanoma. It means more than just a clinical diagnosis. Now you can amputate. You can amputate and do lymph nodes. Those are important facts to remember. Always biopsy when the patient wants a biopsy. The patient's already been to another podiatrist. Always biopsy ugly. Biopsy when you need to apply science. And biopsy when a member of your healthcare team, a resident, a medical student really wants to know. Basically, if you get the patient to consent, you have your 007. If you have problems, you can text me, you can take a photo. If you need to plan a biopsy, you have a question about what approach, call your pathologist. I include my cell, but references. I didn't use any references on this. You can send me an email, or you can call Kim Radigan, who was gracious enough to do the biopsy demonstration. I think that's it for me, so I will stop sharing. And if there's any other questions, then we can open up the field to questions. We have about 5 minutes more.
I just wanted to tell everybody, to remind everybody that people who came in late, you can use the raise your hand feature, and then I can unmute you because it is a webinar, or you can also ask your question in the question and answer box, and Dr. McClain or Kim will answer your question.
Here's a question I see. Someone, Wilvin asked the second question: to decrease compression damage on the tissue, what should we focus on other than slicing with the blade? Yes, slicing is the key rather than pushing. The other thing is squeezing with the forceps. If you squeeze with the forceps, you almost always will damage the tissue. So you can use your anesthetic needle. If you do have to pick up with forceps, you must concentrate on not squeezing, but use them like chopsticks in a sense. You kind of push, coddle, but with a minimum amount of squeezing, I think is the key. So hopefully that answers your question. I think, oops, I answered that. Oops, I already did that.
And Dr. McClain, there's Victoria, and I will allow her to talk. Victoria, go ahead.
Hi, am I allowed to turn the camera on?
I think so. I've never had that you can turn the camera. Yes, you can, because you're on screen now.
Okay, you can see my face.
I can't for some
Okay,
reason,
I
but-
can't see myself, but I wanted to show you my work because this was so exciting. I don't know if you can see it. I'm trying to spell out wound care. Can you see it?
I
Or
can't
we
see
can't.
it yet, but let's see. How do we?
I see her name.
I just see your name, unfortunately, Victoria. I'd love to see
Oh.
your work.
Darn. Yeah,
How do
I've
you
been
do that?
going at it with these punch biopsies, and I spelled out wound so far, and I'm gonna put
Oh.
wound care.
Wait, does she have, is there an option next to your name in order to play video or show video?
That's
There isn't. You have to be a panelist. I'm just learning this, but I'm certain that you can either text Dr. McClain or send him an email of the picture.
Okay.
Oh, do that.
I will do that then. Okay. I'm sorry, I didn't write down the emails and stuff in the beginning because I thought I could just email
That back.
Kim later. So
Okay.
So Victoria, what I'll do, I will email Preeti and I'll give her all the information, and we can get all the information out to all of you who attended.
okay, awesome. Thank you so much.
Yay, thank
Let's
you.
see. Here's my contact info. If you save a screenshot, whoops, is this gonna work? If you save a screenshot, there's my cell and there's my email you can send materials to. So if it's a Windows machine, it's Windows and print screen. If it's a Mac, it's a Control-Shift-3. And the way you share screenshots on your iPhones or Android, I'm sure you guys know better than I do. I'm sorry I can't see your work at the moment. I'm really, it is so much, it brings me great joy to hear such enthusiasm in your voice that you see how easy it is to become pretty adept at this. And you should feel comfortable now when you go to do your first biopsy. Let's say it's a year from now and you know you're going to be starting the clinic. You might bring out some pig skin and practice again, or replay this video. Anyway, I'm pleased to hear about it, and I'm going to stop sharing at the moment, and I'll
Thank
just
you.
listen for other answers or questions.
I texted them to you, so I don't know if you have your phone on you, but they're there.
Okay.
Okay, thank you.
Let's see. Okay. Oh yeah. Let's see. Wound C. There you go. Vicky. Okay. Your shape biopsies look better than mine. Of course, I was trying to do it left-handed, but that's okay. That is fabulous work.
Wow,
And you should be able to quickly do a punch biopsy. It shouldn't take you that long to do it. There's no suturing. It takes longer for the local anesthetic to kick in than it does for you to actually do the biopsy. And you see, you didn't even need forceps to do it. You were able to obtain a biopsy with these, especially with the plunger type tools. So thank you.
and thank you.
Thank you, Victoria. Are there any other questions? Anybody else have anything? If not, we can close up, but if you want to raise your hand in the next couple of seconds. And if you don't, I'm certain if you have questions after this, or if you do this again, I'm certain that they'd be happy to take your questions later on.
Sure. Absolutely, we would.
Okay, well, I just I wanted to say thank you to everybody, especially Dr. McClain, Kim, Devin, and Preeti. This has been a wonderful new venture, I could say. I mean, we this is our first time doing this, so I mean, in time, you know, COVID times, we have to kind of improvise. So this is really new and something that I hope we can do in the future. So I just want to thank everybody and have a great night. Have a great weekend.
Thank you, Pam.
Yeah, stay safe. I hear they're going to lock down the city. So we went through the same thing a few months ago, and it was, in fact, we're still sort of on lockdown ever since March 16th. So I pray for you all. Thank you.
Thank you. Thanks for spending Friday night happy hour with McClain Labs. Thank you, everybody.